Healthcare has changed, guys, period. No matter how you stack it up, it has changed. And unfortunately, it's your responsibility now. And what people don't understand, I don't make any decisions anymore. Does everybody understand that? Like, I'm still a doctor, I can still do the H&Ps, I can still manage your care, I can still prescribe your medications, I can still make diagnoses so that when you have a symptom or an illness that we can make the diagnosis and help you treat it. But it's not done by physicians anymore. Does everybody understand that? Now, does that mean it's a bad system? Not at all. What's it done by?
The government.
Oh, sure.
I get to tell you a funny story.
Oh my gosh.
Computer.
Oh, okay.
Does everybody understand that? Okay. And that's how we got to today. I have a patient of mine who, he's my mechanic. And my father used to pay him by making spaghetti sauce for him. So when my father passed away, I told my daughter, I said, hey, bring him lasagna. We got 8 cars to inspect. And he inspected the cars for the lasagna. Okay, so the guy, as you can appreciate, is wonderful. And what happens is he fills out his living will, and he does all the right stuff he was supposed to do, and it's all written on his chart the way it's supposed to be. And what happened? An emergency accident. What does that mean?
Ambulance.
Well, I'll tell you what happened, but does everybody follow me? This is what we're talking about today. Because everybody thinks everything's nice and tidy. You know, you paid all your bills, you got all your stuff done, your kids are off your back, everything's going the way it's supposed to go, life is great, and then what happens? An accident. What was the accident? This just blew me away. 75-year-old male who had change in bowel habits and had a colonoscopy while he was on steroids for his knee. What do you think might have happened? He perforated his colon. Okay? That's an emergency. Well, what happened? 3 children in the family. The daughter, who's a nurse practitioner, power of attorney. What did she say? Dad has a living will, Dad has a living will, follow his living will, follow his living will. So what did it say? No tubes, no GI, no intubation. Does everybody follow me? And what happened? I got a call from the son, who's also a mechanic, and he's tearfully talking. It's a 65-year-old guy. You know, or 45-year-old, tearfully crying to me about, they told me that if we intubate my father, he has a chance he could live. And I said, well, what's going on? Again, I'm the PCP, and I don't control it. Does everybody follow me? Okay, I don't control it. I have influence in it, and I'm going to teach you today what your rights are so that you also can control it. But this is how the talk came up. That what occurred was, it was over passive in hospital, and I know the guy that runs the ICU. So I called him to tell them the situation and the circumstances. Long story short, he was ventilated and he's home and he's working on my cars again. But he wouldn't be here, guys. Does everybody follow me? These are life-changing decisions, and you have to be aware of them, or you get it now. Did the hospital and all the people that took care of him do anything wrong? From where Joanne and I sit? Yeah. No one had a conversation with anybody. You follow me? No one communicated. All these computers and this fancy world we live in, no one talks anymore. You are entitled to an opinion and a second opinion, no matter what you are doing and where you are. And at the back of your insurance card, there's a number for Medicare. 24/7 they take calls. And they're just like the Department of Transportation. I tell my patients, I'm 100% for people that want to get their license back. The Department of Transportation will give you your license back. And for the heck of it, I was talking to one of the workers, and he said, I've never met a senior who's driven before that are worse than a 16-year-old female. I'm just telling you what was said. Don't boo the person that said it out there. But again, what I want to make sure that we emphasize today as we go through this is, things have changed, no one communicates, you're on your own. Now, what does that mean? It's simple. It's real simple. You just have to have the tools. So you have to know what a POLST is, and we're going to talk about that today. You have to have a designated power of attorney for your health care. Does everybody understand what that is? Let me give you another story, true story. My mother had colon cancer, and as part of her treatment with chemotherapy, it affected her bone marrow. It's called myelodysplasia, where the bone marrow quit working. So she had to get shots and blood transfusions. And one day she just got tired of it. You know, everything else worked, but the blood. And so my father, I got one of those calls. Don't tell your mother I called. Call her out. So I called my mom, hey, Mom, what's going on? So I was at my office, and I told her I would come see her after office. Well, in between, my sister that lives in Nebraska was on vacation home and came in and saw my mother was short of breath, and she went to the emergency room and she got intubated. And she died with a tube down her throat, which she didn't want. And I have another 2 siblings that are doctors, so despite 3 doctors in the family, we didn't get it right. Does everybody understand why we're talking about this today? These are life-changing experiences that you have to make sure somebody knows exactly what you want, and you want to make sure that you know you always have a right for a second opinion, 24/7, even in an emergency. You're bleeding and someone says they want to take your leg off. You're allowed to say, I need another opinion. And there's always someone in the hospital, guys, 24/7. So you're not putting anybody out. You'll hear the nurse go, because you're tying her up. But you're not doing anything that you're not legally and medically allowed to do. So did I emphasize that enough? Today, the most important thing for you to do is to understand all about your rights with this, and then make sure you get somebody that knows what you want. What does that mean? I have an older sister that's a nurse. She works here, okay? And she's in charge. And then I have my youngest brother who's a doctor. Those 2 were called, whatever the term was, proxies or power of attorney for living wills. And they interpreted the condition different than I interpreted it. Who knew my mother the best? You follow me? Who has to make that decision? You have to go with the child, the friend, and you get all kinds of people. You know, you can get, I know a lot of patients of mine that get staff members that work at their doctor's office. Like what they'll do is, doctor's too busy, I didn't get them, but Mary, the secretary's been there for 30 years, and I love Mary, so I made her my power of attorney. That's not a bad thing. She knows your medical history, she has a lot of information, and the key is, what do you want? That's the most important thing. And again, it was funny, Joanne and I were talking about history and the different things that happen over time with healthcare. See, Jim, I found out how I lose those pens. There you go. I have too many pockets. So we're going to do my history. I'll put 70s, and we'll put 2020. And right now, what I'm going to put here is network. And what you all need to learn today, matrix. Does anybody in the room know what the matrix is? Okay. Everybody in this room that has Medicare, unless you have an independent doctor, and there's not too many of us left, you have a matrix in your chart on the computer that if you have my chart with different companies that you're with, anybody can access. And the matrix is a computer program designed by engineers that have no medical experience whatsoever, but they are brilliant, IT people, like they know the internet and the computer inside and out, and they have a score on this matrix that lists your ADLs, your medications, chronic disease, and we'll talk about this and write it down again. And then, unfortunately, they have to put prognosis. Okay? You're all going to know what that means today. If you know what this is, well, we have to do the history. I'll give you the history in a minute. But if you know what this is, and you will before you leave, then you have to find the person to represent what you're thinking. And that's not hard either. Okay? People won't take it if they don't want to take that responsibility. But if you have friends or family members, I know people get their religious people, like, you know, reverends or pastors. I know people that have gotten their old baseball coaches. I mean, there's anybody you pick that has the ability to speak for you when you can't speak. It has an understanding of what you do want and what you don't want. And that's why we have to go through this history. When I started medicine, I put the 70s, good old St. John's Hospital. Anybody know St. John's Hospital? On the north side?
Yes.
It just brings a smile to my face. I got a job there when I was 13. And what I saw there was absolutely remarkable. Meaning quality health care. And listen to what St. John's had in 1979. Anybody know where Wexford House is? In the North Hills, it's a nursing home. That was St. John's. Guess what it was? An Urgicare. 1979. Did anybody ever hear of Urgicares? No, they were advanced. I knew all the people that worked there. I had two uncles that were on the Med Exec Committee there, Dr. Santora and Dr. Nicolette. This was a happening hospital. Anybody heard of Valencia Woods? You know, it's a place, it was over 150 acres, it was their nursing home. So in 1979, they had an Urgicare in the North Hills to compete with Passavant. They had a 150-acre nursing home in Valencia. They had a 180-bed acute care hospital. They had a 120-bed drug and alcohol rehab center. 1979. Is everybody with me? They were advanced. They were so far ahead of anybody else. And I know that personally. I was there. What happened to it? It's one of 5 hospitals I closed. The last one, Suburban General. I sat on the Med Exec Committee. The year we closed it, 27,000. Let me repeat that number. 27,000 pediatric ER visits, more than Children's Hospital. But of course, what was their plan? UPMC built, AGH built, and everybody thinks they're hospitals. They're not hospitals. They're outpatient centers. It's not Part A, it's Part B Medicare. Does everybody follow me? You got to wake up, guys. All this stuff is happening around us and we're not paying attention. All right, so what did I know in the 70s? I know what healthcare was in the 70s and what we did with it. Great case, my younger brother, he's 12 years younger than I am. He was on 3B. If anybody knew Mrs. Graham, she was the nurse there. He came into the hospital, he was probably, 7 years old maybe. And Mrs. Graham just didn't like the way he looked. That's all she told my uncle, who was a surgeon. I don't like the way he looks. They ended up in the ward bed. They took his appendix out. Does everybody follow me? Like it isn't what they're making it out to be. That's this vast organization, and I'm purposely walking around so Jim has to follow me, by the way. This vast system that's so intricate and so necessary and needs all these brilliant people. BS. When physicians ran it, everything worked. And what did they do? They steamed the instruments. I used to work for Tom Starzl. Another good story. I would tell stories all day. I'm up in Erie. I was a scrub tech at Hammett Medical Center. And they call it about 1 in the morning, said Starzl's coming up to take a liver. So I scrubbed for the case. And I do the case with him, and we're talking the whole time. So as he's leaving, he's taking his gloves off, and he said, so what's a kid from Pittsburgh working in Erie for? And I said, because you didn't hire me yet. And he hired me that day. And I traveled around picking up livers with him, and then I was going to do surgery with him, and it went to a joystick and a scope instead of your hands. So then I went into medicine. But the point comes back to where we are and where we've been. You have to understand, and you have to recognize what's your responsibility. And key is communication. Why? It's not necessarily what you don't say, so you're allowed to say, I don't know, or I'm not sure, as opposed to saying something that gets in your chart. Does everybody follow me? Have a patient, goes for dialysis, she's in the hospital with cellulitis, she goes to dialysis, she comes back, physical therapy walks in, Mrs. Smith, we gotta go down to physical therapy. She goes, oh, they just put my breakfast in the microwave. I want to eat my breakfast. What did the physical therapist write on the chart? Patient refused physical therapy. What happened? When she got discharged, even though she was in the hospital for 2 midnights, you guys know that rule? You can't get skilled benefits unless you're in the hospital 2 midnights. You know, what accountant or lawyer made that rule up? But the bottom line was she was in the hospital for that period of time, but because she said, refused in the notes, they denied her skilled benefits. Does everybody follow what I'm telling you? This is healthcare today. Now, all that being said, it's still the best healthcare in the world. Pittsburgh, Pennsylvania especially. We have everything here. Everything, A to Z. So there's not any services you can't get. Unfortunately, what's happening? It's being delayed. Why is it being delayed? Because the system has changed. Does everybody follow me? I've been doing this. That's what Joanne and I were talking about yesterday. Do you guys remember the commercial? I don't know all the guys. Who was the great dancer back 40 years ago? Dancing in the Rain was the commercial. U.S. Healthcare. There you go. That commercial signed up 100,000 patients to that healthcare plan. And the guy that was selling it got $1 million bonus. Is everybody with me? It's big business, guys. Big business. And it shouldn't be. It should be real simple. So enough about yesterday. Let's move forward. So what do we see? We see from the 70s, hospitals went from independent and nonprofit to networks, and they're allowed to make a profit. So how many times did your healthcare premium go up while they shut down Suburban and built a new hospital in Wexford? Right? But of course, back here when we talked about it, we would get in trouble. And I'm independent. The doc that was owned would get fired. Is everybody with me? So that's what happened to the system. Because I'll tell this, give this talk, and I'll have patients say, well, why didn't the doctors do anything? This was well planned out and thought out. This wasn't just something that happened overnight. And so where we are now, the networks are called ACOs, Accountable Care Organizations. And what that essentially has done is Medicare is now in risk sharing with who? The doctors. There may be some profitable ones, but to the best of my knowledge and research, there's no organizational healthcare system out there that owns and operates physician practices that are profitable. Does everybody follow me? Okay? If I wasn't profitable, I wouldn't be in business. So how did they take a practice such as mine, have it get sold to the system, and in a short period of time, they're not profitable? Does everybody understand what I'm telling you? And it's easy. If you lose money, it helps the books. Okay? So understand all this has occurred, guys. The only reason I'm beating you up and walking you through this whole process is so everybody understands. So in this period of time, when I was still down at Suburban General Hospital, I used to carry about 10 or 15 patients. So the nurse would grab my charts and we would sit down face to face. And she'd stack the charts up, and face to face, we would go through every patient. That was standard of care in American hospitals in the early 90s. So all of a sudden I walk on the floor one day and couldn't find my chart. Who has my chart, guys? Oh, the case manager. What's a case manager? And out of that I found I was a PCP. You know, before that, it was simple. The doctors and the nurses ran everything. All of a sudden, managed care came in. What's managed care? The start of healthcare today. And what was it for? The mantra is always the same thing. To ensure more people and get the cost of healthcare down. That's what you hear. And as we went through the process, that's when you saw things change and you realized physicians weren't in charge anymore. And it was amazing how they did it. People always tell me, how would you fix healthcare if you could? I said you'd go back to 1979 St. John's. And they looked at me like, what do you mean? And I said, the Hubbard Street Clinic. I don't know if anybody knows that area, that's where the clinic was. The nurse in that clinic knew everybody in that community. How do I know that? On the one wall, she had a map of the north side area that was hers, and she had little, like, pins of all her patients. So there was no such thing as people didn't have health care. How do I know that? Dr. Nicolette and Dr. Santor were on staff there. What did you have to provide to be on staff at St. John's Hospital? 2, read my lips, free. 2 free days a week. What does that mean? If you were a surgeon, the operation was free. Does everybody follow me? This was healthcare in 1979 in the north side of Pittsburgh. So everybody had healthcare. And everybody had access to healthcare. But it all changed. Okay? So that's how we got to this part where now, because of all the changes, places like St. John's closed down. And we went into a system called managed care. And what managed care does is just like it says, manages the health care. And what was remarkable, as I followed it, I was amazed at how they made things work. Kind of like the same company, free eyeglasses, there was something with prescription benefits, oh, and hearing aids. That's what they provided. And that's what got a lot of people to sign up. Okay? And what happened after that? Medicare Part D, which was prescription medicines. So back when I started, there was A and B only. There wasn't a C and there wasn't a D. Does anybody know what C is? It's managed care. And they get the A money plus the B money plus 10%. I did say 10%. A 10% profit is built into the managed care. So that's where our Medicare dollars go. Okay, so this whole system changed. We're now in the new one. It's called an ACO. And why I'm telling you what I'm telling you today is you have to be in control. And when I put decisions, hope I spelled that close to right. Decisions. Who knows your healthcare history? I'll put H for history. Now, why do I say that? I thought it was pretty remarkable. I have a lot of patients, and then I found out myself after I thought it was just my patients, where the husband and wives don't know what each other does and doesn't really know each other's health. And I thought, I know everything my wife does. She knows everything I do. Wrong. Holly, my nurse practitioner, she does Botox. I think that's what it's called. Like if you have a line or something. She's supposed to do me, so she said I had to lose 50 pounds first, and then she's supposed to do my head to practice on me. You know, I just laugh. But someday if I come in without wrinkles, you know Holly got to me. So she's telling me all this stuff, and she goes, ask your wife. She may want it. And I go, my wife doesn't have time. And so for the heck of it, I ask her. And she goes, no, I already have somebody. I see him like 2 or 3 times a year. And I was like, oh my goodness. I didn't even know. And that's when you realize that your body is personal for you. And maybe your spouse doesn't know everything that he or she needs to know. And I'm not saying that's a bad thing. I'm just saying pick somebody like your best friend, or somebody you tell everything to, or somebody that knows everything about you and knows what you want. And what do I mean by what you want? That's the biggest factor, guys. That's why we have to go through this today to understand. Back to that front chart that I showed you, and I'll put it down here again. Today, everybody has to know what ADLs are. Everybody has to know what intubation means. And with that, it's called ventilation. Everybody has to know what a feeding tube is. And everybody has to know with, it's called cardiopulmonary resuscitation. Again, if you know this and that other page that I showed you, you'll be well prepared. Let's start with the last one first. Great story. So I have a patient, he's passed away since, but Angelo Camerata. I don't know if anybody knew Ange. He was from Westview. It's just a smile to my face of what this man did in his lifetime. His family owned a grocery store. And after Prohibition went away, his father told him to buy a bar. So he built and bought a bar on the Westview, and I think they put 20 kids through college. Okay? But what was neat was Ange was the oldest bartender in America. So he calls me one day, and he goes, Letterman or, what's Jay's last name? Leno. And I go, what do you mean? He goes, I'm the oldest bartender in America, and I was called by both of them to be on the show. And I have a friend that lives in Burbank. So I said, oh, let's go to California. So we got tickets, we had everything all set up. We were going to go for him to be, because I said, you got to bring your doc. Tell him you have to bring your doc. And so it all worked out. We were all set up. They even interviewed him over the phone with all the questions he was going to get asked. And he calls me. We were going Thursday night, and we were going to be on Friday. They tape it at like noon. He calls me Wednesday morning. He goes, we got bumped by the homosexual. And I go, what? We got bumped by the homosexual. I said, Ange, what the hell are you talking about? And he goes, they put Ellen DeGeneres in our spot. So we didn't get to go. But what I loved about Ange, he was my patient. If you guys know Rochester Road and Swickley Oakmont Road by Manor Care North Hills, he lives up on this side. So we had this terrible snowstorm. 7 o'clock in the morning, he leaves his house, comes down to the corner store, and as he's pulling in, not on the road, in the parking lot because it wasn't paved, he slides into the cement thing that holds the car in the parking lot, and it bends his tire. He's 99 years old at the time. He calls AAA, and he calls, who did he call? I think one of his sons, to alert the mechanic that the car was coming. He goes in and does his grocery shopping, like the stuff he wanted, right? It snowed, bread, milk, eggs, stuff like that. And he comes out and there's a cop writing up a ticket and took his license because he's 99. And he tried to argue with him. So again, he was the first person I got out. Because, you know, he's sharp as a tack, physically fit. So I wrote everything up and he got his license back. You know what he did? He took a pair of scissors in his new license. He waited till the cop that wrote him the ticket was there. He walked into the precinct and he had his son with his cell phone take a video. He said, "Hey, I just want to show you I got my license back." And he cut it. He said, "I don't need to drive, but you're not going to tell me I can't." And that was Ange. That's how Angelo was. So Angelo's walking into the stadium, I think it's called PNC Park, with his son. His son drops right in front of him. Down. Heart attack. 99 years old at the time. He turns, whistles, because there's an ambulance at the corner. Does one of those whistles, like real loud, because I said, "Let me hear you whistle," and it was loud. Ambulance comes. He's on the table getting open heart within 20 minutes. And his son is alive and well. 5-vessel bypass. Okay? Guess what? Guess what was on his chart? Do not resuscitate. What happened? Ange walked into him, and when the doc came over and said, "Excuse me, sir, this says do not resuscitate." He says, "I don't give a blankety blank what it says. I'm his father, and you're going to fix his heart right now." Does everybody follow me? It's not a legal document, it's a guide. You need to have that person that knows what you want. And as long as they know what you want, you don't have a problem ever. Because there's allowed to be changes when accidents occur. Does everybody follow me? And you have to understand what's happening. This is what I told my buddy Nathan in his father's situation. TNT. My father had an aneurysm. 2016. I got him a nurse. The nurse calls me. "Dr. Coppola, your father's having back pain. He's uncomfortable and wants to go to the hospital." If anybody ever wants to go to the hospital, you let him go to the hospital, okay? So I get down in the emergency room, I walk in, he's sitting there, and I ask him how he's feeling. They had just done an x-ray. So I go out to the desk, and the doctor comes up and says, "Dr. Coppola, that aneurysm's about to go." Dad at the time was 82, okay? So I said, "That bad?" "Yeah, we got to know now what we're going to do." I said, "Okay." So I walk in, right across from the office. I walk in and I said, he was a physical therapist, so he understands everything. And I said, "Hey, that aneurysm's about to let go. You want to get it done, or are we just going to keep you comfortable?" And he said, "Well, what the hell, I'm here. I might as well get it done." Okay? So I walk out of the room and I say, "Hey, can you get a hold of Dr. Maluk? My father's decided," and all of a sudden I hear, code red," and I turn around, it ruptured while I was standing there, okay? So I had already told them, they said yes, they whisked him off, and my whole family's like in the waiting room, because I was the only one in, there's only 2 people allowed at the time. So I go out, get my family, we go to the cafeteria, everybody gets a breakfast. Cost me $27 because I had to pay for it. And then we go up, everybody sits down, I'm putting all the trays away, and I go over, Dr. Maluk on the phone. "Matt, everything went well, he's in the recovery." Does everybody follow what I'm telling you? Fantastic medicine in Pittsburgh. Fantastic. But you got to know your way around. And that's what this is all about. You have to learn how to maneuver through the system. And you see, had I not gone there that night, and we hadn't had the conversation, and I didn't tell the nurses, on the chart was do not resuscitate. He would not have left that emergency room. And he died at 86. He had 4 ornery years. I hope when I get old, I get ornery. My grandfather was like that. My father was the nicest guy in the world until he got older. But again, what I'm emphasizing is you are allowed to change. Does everybody follow me? And you write that on there. Any sheet you're given, you can write anything you want. and you can put a little star on there and write, may change in an emergency. And all they need to do is call somebody. And you see how fast it goes. You see how quick everything is. I told you about Ange's son dropping, open heart, he's across the street. My father, right in front of me, aneurysm rupture. And he was fixed before I even had a bite of my eggs. Like, that's the technology that's around, that's the health care that's around us. But if you don't maneuver through it, they're going to take everything you say, and again, guys, it gets documented. And nowadays, I don't know if you guys know about artificial intelligence. If you guys have cell phones, like I still have my flip top. Okay, just the one I use. I'm on call, so I have to have this one. Okay, this one, they know where I'm at. How do I know that? Good story. I tell too many stories. I lost this phone on Tuesday, and I have all my codes and stuff in. So I see Holly at the hospital. On her phone, she told me where it was. She's got some app. She's got me all wired. I mean, Joanne just knew what I was doing all the time because that's how she was. Holly knows everywhere I'm at constantly. But again, that's the technology that we have. So where we are now is cardiopulmonary resuscitation and TNT. That's what's referred to as standard of care. What does that mean? Everybody, if they work in a hospital, have to be CPR certified. So that means, God forbid, something happens to you, they will be able to keep you functioning till the ambulance gets there. And hopefully the ambulance is quick. So my sense would be that, and I don't advise anybody in here to do anything and change anything they're doing, I'm just telling you historically what I've seen. When I first started, a lot of people didn't want CPR and they didn't want TNT. What's TNT? Trach and feeding tube. That's standard of care now, guys. And what does that mean? Does that mean it's all of a sudden okay and it wasn't okay 20 years ago? Sort of. The technology has advanced. What does that mean? Years ago, when they did a trach, you had to put a, what's it called, turtleneck sweater because you didn't want anybody to see your scar. Now, it heals up, you don't even know it's there. And the same thing with the tube in the stomach. You have to understand, when they do the procedures, if anybody's had an endoscopy, they put the scope down to the stomach, well, they shine a light. And they put a little xylocaine so you don't feel anything. And the tube, it takes literally 5 minutes to put a tube in. 5 minutes to put the trach in. What do you have now? You have access to the airway, and the lung is the largest surface area in the body. So you can give medicines through it as well. So the trach benefits the treating team for keeping you ventilated. And what's ventilation? What you want to know about ventilation is getting rid of carbon dioxide. Follow me? If you have trouble with your lungs, if you've ever smoked, or if you have a heart attack or a problem, the reason you need the ventilator is to get rid of the carbon dioxide. So they put the tube in and they turn the machine up so you get rid of the carbon dioxide. And again, if you have it for longer than 5 days, it's recommended to put the tube because you don't want the other tube pushing against your vocal cords. 20 years ago, the thoughts of it scared everybody. Now, it's standard of care. That's what they do. Why? Because it gives better control to the team. Similarly, feeding tube. What can they put in the feeding tube? Food, water, medications. I mean, it's a port that enables the team to treat you well. And both of them, once you're well, you won't be able to see them. It's not like it's a big scar that you're going to have forever. These are small little nicks in the skin in both locations to gain access to the lung and to the GI tract. And please understand, guys, I'm not here to sell you, I'm here to educate you. That's what it is. And this is standard of care today. If anybody went down to the hospital, say COVID, this is perfect, COVID time. If you went into the hospital ICU on a ventilator with COVID, you had a peg tube put in, the feeding tube. That's standard of care. They want access to the GI tract. Okay? That's what we do nowadays. So understand that as you make your decisions. This one is important to understand. ADLs. What are ADLs? Activities of daily living. Bathing, dressing, eating, transferring, let's see, this would be toileting and continence. Okay? How to best describe this. Early 2000s, none of this mattered for your care. Okay? Everybody's different. And if you're my patient, you know I ask you if you move your bowels, you know I ask if you pass your water, you know I find out what you eat all the time. That's conversation. That's communication. What now has happened is this is the template for where you go once somebody sees you. Where do they see you? Outpatient, inpatient. It's called a matrix. That's going to get filled out. Do they tell you that when they're talking to you? No. They'll ask you what you ate, and then they'll say, oh, did you make that, or did you have it sent in? And you may say, oh, my daughter dropped it off last night. Or no, I still cook, I'm a good cook. So while they're having a conversation with you, they're filling this out for the matrix. So, do you bathe? Does anybody realize how important bathing is? Okay? I mean, we all do from the knowledge of keeping yourself clean. Okay? There's no doubt about hygiene-wise. I'm talking about your answer to that. You get into criteria if you don't take a bath or a shower. You're allowed to take either one. But if you make a statement to somebody who asks you, no, I don't bathe anymore, I go to the sink or whatever, that gets checked off. Everybody follow me. These are things that make a difference. So don't lie, don't ever lie, but make sure you pay attention to what's being asked, and the best response you can have is, what are you asking? Ask them what they're asking. And if they come and tell you about the ADLs, then you tell them, yeah, I'm still able to bathe myself. Don't lie to them. Make sure you can. Your bathing is your choice. I tell people all the time, I grew up on a farm. You know, my grandmother was born in a farmhouse, so we went up every summer. There was no hot water, there was no telephone, and there was no television. And people were like, what did you do? And you had a blast. I mean, you know, farms are great. But I can still remember you froze when you got in the shower. And so it was like, you ran in, you ran out. And my grandmother said, did you even get the washcloth wet? And you'd be like, oh no, so you got it wet while you said, oh yeah, and then you got it wet because you knew she was going to check. But the whole point is, it's one of the questions on the matrix, and you have to be able to bathe yourself, okay? Again, if you don't have a shower with a chair in it, or if you don't have the sticky stuff on your shower, or if you have a throw rug that's going to slip, don't let someone in your house, because they don't have to come in your house. You follow me? And if you feel safe, you're safe. But they're not going to tell you, but that's what they're looking for. So they're going to say, oh, Mrs. Jones, we went to her house, we did an assessment, and I don't really think she can bathe herself, and I saw her shower area, and she doesn't have any such and so mats, and she doesn't have this or that. Pay attention. It's important. And again, I think we all should be able to bathe ourselves, so make sure if there's problems with it for you at this moment of your daily routine, find a way to improve it. Because it makes a difference, guys. That's why I'm going over this with you. These are the things they're going to ask you. And they don't tell you that they're asking you for the matrix. They just come in, oh, I got some questions to ask you. And they run through it. And of course, you probably had someone ask you 10 of those already down in the emergency room. So you're tired and you just throw out the answers. Pay attention to what you're saying. The second one is dressing. okay? I find it amazing. My kids said I couldn't take care of the house once they all left because my wife works away, so I'm an empty nester and I live on a farm. And so what happens is I really do wear the same stuff, not at work, but at home. Like, I may wear it for a while, you know, and my wife will say crazy stuff about it. And then she'll throw everything away whenever she comes home. And I'll go, oh man, I just wore that shirt one time. And she goes, well, I'll get it washed, I'll take care of it. But it's stuff like that. When you're by yourself, you just want to be comfortable and put it on. Don't tell a person asking that question that information. So everybody follow me. You can dress, you can put your underwear on. Oh, it's funny. My grandfather, when my grandmother died, she had one of those things that you put your makeup and stuff on. It had a low chair and all these mirrors. And after she passed, he kept that because he liked the chair to put his socks and shoes on. And I used to bust his chops, like, you can't put those socks and shoes on? He goes, you wait till you get my age. And oh my God, it hit. Where, you know, I run around and play sports with Dr. Jagiello, and sometime the next day I can't even move. And you have to like grab your pant leg to lift your leg up to be able to put your sock on. All those things are part of what they're asking, but they don't tell you that. So don't lie, because if they check you and you can't, that's worse than saying, I don't know. You know, but practice it if you have to. You know, and it's funny, I went from jockey shorts to boxers because they're easier to put on. It's amazing, guys, all the changes, but still, you're going to be asked, make sure you pay attention. Eating. They want to know if you leave the stove on. They want to know if it's a hazard. Same thing, do not lie, but I find they changed my whole diet. And it's funny, my kids think I'm on a diet. I said, no, I only gain weight when you guys come home. You know, when I eat by myself, it's real simple. But what happens is they want to know breakfast, lunch, dinner, snack. Are you preparing foods? Are you buying foods? Are you cooking foods? Are you microwaving foods? Don't lie. But don't give up a whole lot of information. One-word answers. I hope no one's ever in court. But when I had to go one time to testify, that's what the guy told me. Yes and no. Don't say anything else. Yes and no. So that's what I would tell you. When they're asking you these questions, just give them a yes or no. Don't get into any details. You don't have to give them details. And again, please check for yourself, guys, because it's important. The bathing, dressing, and eating, those are the top three. And they will ask you questions in circles to try to get information on that. And again, please be cautious and careful. If you guys have gas stoves, make sure you don't have any doilies around your stove. You know what I mean? Like, because I have to tell you that one. My wife got me a fancy robe for Christmas a couple years ago. And she bought a new stove. And I was making breakfast for everybody. And I turned it on. You know, it's when it clicks first before it comes on. And you hear click, click, and when it came on, my whole sleeve caught on fire. It was like, poof, and I just turned it and looked. Dad, your arm's on fire. It's like, oh yeah, right. Oh, my arm's on fire. You know, it's amazing. But that's what they're looking at. They're looking to see, is there a hazard? So if you have electric, you're covered. If you have the gas, always say, well, don't lie. Don't ever lie to them, but pay attention to what you say, guys. It's important, okay? Transfer, what does that mean? Another one of those, oh, this is an amazing day. I'm teaching Homeo how to golf. And I play soccer with Dr. Jagiello on Sundays, and we started softball. We played 2 double headers on Sunday. So this one particular Sunday, I played soccer with Dr. Jagiello, played 2 games of golf, or 2 games of softball, and then I golfed with Homeo. And I literally couldn't move. I mean, the next day, I was so sore, it was incredible. And then I dropped something. And oh my goodness, it's amazing. Like, I had one foot up in the air and I'm holding on to the wall with the other one, and I couldn't bend this knee to get to it. And I went down on the ground to get it, and then I couldn't get up. I mean, it was like I found myself having to crawl to a chair and kind of flop on the chair and use my arms to stand up. And that's what they're looking for. I mean, those are the kind of things. And again, if you're not good at it, because I found now, you almost have to force yourself. Like, you force yourself to just do it. And it's amazing. You guys will appreciate this. Those who don't know my practice manager, her name's Dana. She's engaged now, and her fiance plays softball with us now. So she goes to all the games. So I was on first base. The ball was hit into left field, or where was I at? Right field. And as I was coming around second, there was no third base coach. So I turned and looked, and it was in the gap. And as I was running to third, people in the stands said, "Get down, get down." That means slide, right? So I thought right away, like, I'm not hurting these knees. So I dove. Well, we were the first game, right? So they lined the field. My face went right into all the line. So I came up with a white face, but I was safe. It was fun. But the whole point to everything, guys, is practice some of this stuff too. Like, get yourself up and down, find ways to do it, because you don't ever want to lie to any of these people. These become documents, and if there's something on there that's not true, that puts you in a bad light. But that's why I'm putting them up here, so you can practice them. So transferring is important. How you transfer. Getting in and out of the car. You know, the way they want you to do it is when you're sitting in the car, they want you to bring one leg over, the second leg over, scooch to the end, and then lean forward. Don't push off the door. Okay? Make sure of that and practice it if you have to. Those are the things. They're not going to tell you this. They're going to ask you, and once again, you don't ever have to invite them in. And I would suggest don't, even if they offer you a $50 gift certificate. Because I had a patient one time say, "Well, the nurse can't." I said, "Well, what'd you let her in for?" "She gave me a $50 gift certificate to such and so, so and so." I said, "Well, that's how they get in." So please pay attention. Toileting. All right. This is another big one. If you drink enough water, you probably will have no problem with passing your water. The problem is, you probably get up more at night than you want to. And so a lot of us will stop drinking the water because you don't want to get up at night. Okay? That doesn't fix the problem. But they're going to ask you questions relative to that. So don't lie, but pay attention to the questions they're asked. I haven't thought about that. I'll have to give that some thought and let you know. That's a good response that you can come away with, okay? But the bottom line is, they want to know are you independent with toileting? Are you continent? That's the other part of it. And it's amazing, guys. When was it? I'm trying to think of when it was. I think I was golfing. It's a couple years ago. I was golfing, and my son, they were drinking. They do a drinking game where they put a hole in the beer can and hold it with their finger, and then they put that hole over their mouth and crack the top open, and the beer shoots in. Okay, so they were like, "Hey, Dad, try this." I was like, "I got to go to work tomorrow," right? So I'm just standing there, and as my son gets done with it, he goes like this, and ends up hitting me in the stomach, and I lost control of my urine. I mean, it was unbelievable. I was like, and you're like, stop, and you think, "Oh my God, like, you mean that's going to happen?" You know, it's amazing. It's absolutely amazing. So what I have found is that the continent question that they ask you about, how they get away with it is, have you ever lost urine when you laughed or you coughed or something like that? And again, don't lie. But you can always say, I haven't thought about that. I'll have to give that some thought. Remember that response. That's a good one. But once again, guys, I do this, and I talk to patients, but I didn't realize this is a big part of what they're looking for to be able to put your matrix together. And again, what's on that matrix, and that's why I put that up here, the ADLs, medications, chronic disease, and then they come up with a prognosis. Medications. Does everybody in this room know their medications well enough to say them as you're asked? You don't have to answer me. If you don't, make sure you know the ones for major organs. The brain. If you're taking medicine for your memory, know what it is. Eyes. If you're taking eye drops, you're allowed to say, oh, I take eye drops for glaucoma, because you know it's glaucoma. It's good to know if you're taking Zalatan and all the different ones that are out there, but again, just know you're taking the eye drops. Are you taking anything for your sinuses? You know, are you on medication, Claritin, different things like that? Do you have thyroid trouble? Are you taking? They want you to know that you're taking thyroid and what the thyroid medication is. If you're on anything for your heart, they want you to know that. As your physician, if I'm your physician, I want you to know it also, but at the same time, to me, I don't grill my patients on, do you know the medications that you're taking, what's it for, what's the side effects, all those things. Not that it isn't good to do that, but there's always a risk-benefit to medicines. Doctors just don't sit back and decide they're going to give patients X, Y, and Z medicine. It's usually for a reason. And so if you have high blood pressure and you pick a certain medicine and that particular blood pressure can make your potassium low that you have to replace it, if it's helping your blood pressure, that's part of the downside to the medicine. But the whole point is you should know them. Similarly, if you have lung trouble, you should know your lung medicine that you're on. If you have any difficulties that we call autoimmune, rheumatoid arthritis, lupus, any type of rheumatologic disease, and if you're on a medication that alters your immune system, know the name of the medication. How do you get the name? Write it on a little index card, put it on your table. You look at it 5 times in a week, 2 weeks, you'll have it done. It works, guys. You'll know it. And again, it's good to know when someone's asking you those questions. Okay? And again, why is it important? The medications and chronic disease, they're the ones that fit into the matrix. Okay? We're not out to beat the system. We're out to know the system and understand the system, so you know how you fit in the system, because this is how it works now. So as they're developing the matrix, they look at your medications and they cross-reference that to your chronic diseases. And then they statistically analyze it. I'll put stats. And they come up with the prognosis. What does that mean? Let's say you have diabetes, hypertension, coronary artery disease, and rheumatoid arthritis. And the medications, one of them you're taking is Humira, and that's a autoimmune disease, and you're taking insulin that you have to inject, and you're taking 4 blood pressure pills. When the computer puts out your matrix, your prognosis is going to scare you. You follow me? And it's there. And I would tell you, don't even ask to look at it, because all it is a statistical analysis. But I've had patients that got real upset, because when I do these lectures, I tell you guys all this stuff. And that's your record. You're allowed to ask your doctor anything. But what happens is, if you ask to see it, people get scared sometimes when they see what the doc puts as the prognosis. And again, guys, it's not the doctor being mean or vicious or trying to get you out of this world, if you will. It's the computer. And when you put all that data, if I had this information and say the patient was 85 years old, had open heart surgery in 2018 and needed a stent in 2019, your prognosis isn't going to be more than 24 months on their sheet. Now, does that mean you're going to be gone in 24 months? Heck no. That means nothing. But what am I telling you? That's running healthcare today, not me. Does everybody follow me? This is all computerized. This matrix knows everything about you. How does it know that? Yes?
When you say, statistical analysis, is that dealing with input of data from a wide group of people?
Sure.
But it doesn't predict who the individual is the problem.
Well, I think what happens is they sell it like it's individual, but it's not. I mean, right.
No
But
statistical data can predict who the individual.
true. But what happens is nowadays all the computers talk to each other. So wherever you go, if you go to an urgent care, if you go to a chiropractor, if you go to a chiropractor and they're part of one of these ACOs, they're going to put information in there about you. And what's remarkable, like I said, is I didn't know my wife got Botox shots. You follow me? So there's information that like even your doctor doesn't know. Because is it relevant or not relevant? Like the big thing is nowadays, were you exposed to any drugs? Have you been on any drugs? They ask if you were born before 1962, you got to get a hepatitis C test because they're selling the drug for hepatitis C. There's no risk of hepatitis C. You know your sexual history. You know whether you were promiscuous. You know whether you were unprotected. You know whether the person you were with had IV drugs or not. You know all that stuff. But the commercial tells you otherwise. And then you go get the test. Does everybody follow what I'm saying? It's big business, guys, big business. And what you have to do is know what's important, and what I just went through for that matrix is important. So now, let's go over this last part, and I'll let you guys go. Post. This is a form that should be available on all patients. And they want to know, do you want CPR or not? They want to know if you're intubated or not. They want to know if you want chest compressions or not. They want to know if you want IV antibiotics and IV blood products. And I listed these 5 because these are the top ones. Okay? Actually, I really don't have a problem with this, but it all goes back to the emergency. And I would say, I've been doing this 30 years. Most of my patients say, Doc, if I have no chance of living a normal life, then I don't want all this stuff. Okay? That's realistic. That is wonderful. The problem is technology has advanced. So what you may think is extraordinary care, nowadays is standard, like I told you with the trach and the tube. So you have to have somebody you know, personally know who you are, what you want to do, and get it done that way. So what does that mean? God forbid there's an accident. I told you about Angie's son having a heart attack and dropping on the floor, or my father's ruptured aneurysm, a car accident. Trauma. I told you about the patient I had, my mechanic who had a colonoscopy and they perked his colon. Those are all tragic accidents. So everything has to be re-evaluated at that time. That's why you need the person that knows you. And as long as they know you, they need to get the information. Can they get the information? Yes, but you have to ask. And somebody should never push you. And I told you that's what happened with my buddy when he called me. Because what his father had written, he wouldn't be here. What my father had written, he wouldn't have been there. You have these emergencies that come up. That's why you need to have somebody you designate that knows what you want. Now, what do you want? Okay? Everybody's different. I mean, some people, they want to be there no matter what. Doc, as long as I have brain waves, I want to be here because I want to be a burden to my daughter. I've actually had patients tell me that. Okay? But at the same time, there's other people that say, if I have a heart attack, let me go. Even though the technology is phenomenal. Nowadays, you can have a massive heart attack and still do fine. But that's what the person wants, whatever your wants are. But you have to go through it. And I'll give Karen, actually I'll make Homeo do this because you guys aren't on the computer all the time. What it is a checklist to go through as you fill this stuff out to make sure you understand it. Meaning, what does it mean for CPR? Okay, everybody talks about, oh, they're mean to you, or, you know, they broke my breastbone, or they fractured a rib, or something like that. That's some kind of extraordinary, that happened 20 years ago. Nowadays, everything is slick, guys. They have defibrillators most everywhere. You know, so I think you guys have one, if I remember. Someone said you guys, yeah, there you go. So they're everywhere nowadays. So, you know, no one's going to come in and bang it on your chest. But the whole point is, technology has advanced, but if in your mind's eye you still don't want resuscitated, don't be resuscitated. Don't change because the times have changed, but pay attention to the questions you're asked, the answers that you give, and then the things we talked about. Go through in your mind's eye to think about it. You know, I have no problem with the trach, I have no problem with the PEG tube for any emergency situations. I would never advise it for my patient for them to stay alive and well by having to have a trach and a ventilator for the rest of their life. But if they want it, I'll make sure they have it. I mean, you have to know what the person wants. That's what it comes down to. So you designate your power of attorney for health care by somebody that you know well enough that you can tell them anything about anything and that they would know. We get called, though. I have to also let you know that. When you walk in and you say, yeah, I'm Mrs. Jones and Dr. Coppola is my patient or my doctor, I will get a call from that emergency room, even if you're in another state. That we have Mrs. Jones here, she's just had an MI, she's listed as do not resuscitate, we can't get a hold of the daughter, you know, what do you think? And then I have them give me information. And I've changed it, and I've not changed it. My greatest case was I had a guy that went to the Philippines to ride an elephant. Right? While he was there, he had a stroke. And do you know every ambulance in the Philippines has hyperbaric oxygen? Saved them. It was unbelievable. You know, and they called me from down there. They had to get an interpreter. I was in, what the heck was going on? And once they get on, they say to me that, you know, what's his history? They wanted to make sure. They did a scan, and they found that he had a big stroke on the one side, and he was doing okay. And we coordinated it to get him back to go to rehab. And he did great. He's still around. But my whole point is, even if you're out of the country, they track me down. You know, so your PCP will be contacted. And I don't want anybody worried that they don't have everything they need today and an accident's going to happen tonight. But I want everybody to pay attention to the fact that what you say makes a difference. And listen to the question before you answer it. And think about your answer before you answer it. And you're allowed to say, I don't know, or remember, I haven't thought about that, I'll have to give that some thought. That's a good way to get away from it. And again, guys, I'm not here to jimmy the system, but I've just seen too many times where things happen and they shouldn't have. And that's why I think it's best to just make sure, hopefully you got a handle on what I was talking about historically. And back to that front page now. The activities of daily living. The bathing, dressing, and eating are important. Those are the big three. Those are the first ones they're going to ask. So make certain that you pay attention to that before the questions are asked. The medications, know your medications, because what they'll say, they don't say demented, but they'll say, I sense some memory problems, the patient can't even tell me what her medications are for. Stuff like that. And again, like I said, guys, write it down on an index card, put it on your table, look at it 5 days in a row, in 2 weeks you'll know it. Your memory's still that good. So it's not like I'm making you take a test, but have this information because it's important. The chronic diseases they look at, that's the prognosis part. And it is what it is, guys. That's just how the statistics are done. They analyze this and they come up with a prognosis, and the prognosis is there. I'm going to forget this. I think it's 78. Medicare patients use up 78% of their benefits in the last 6 months of life. That's why this is all being done, huh? Has nothing to do with what they care about. So I'm here to tell you that communication is horrific, that doctors don't run everything. It's up to you. But remember what I told you. Pittsburgh, Pennsylvania is still the best in the country. We have everything, everything. and it's at your fingertips. And it truly is. The network is phenomenal. So you're in a good place, and especially here, because you guys have everything all set up. The patients that leave their house and end up in the hospital, then someone sends them to a skilled nursing unit, and then someone says, well, you can't swallow, you got to go to a personal care home. And all of a sudden they're spending $6,000 a month of their life savings, and no one realized that the reason that they can't swallow is you didn't put their teeth in. You know, it's crazy. And you laugh. I'm telling you, I've had it happen. That's why I'm bringing this stuff up. It's not the way it used to be. It's what you need to walk away with today. And understand that page, because that's important. All right, guys, sorry that Jim made me late today. Otherwise, I'd have been on time. I get to give you one joke. Dr. Jagiello gave me this joke. So the nurse calls the doctor and says, doctor, we have a new patient for you today at 2 o'clock. Doctor says, what is it? The guy's invisible. Tell him I can't see him today. Thanks, guys.